I'm Susan McLennan from Banff Plastic Surgery, and this is a video about labiaplasty. Labiaplasty is something that can be difficult for women to talk about, even with her own doctor. With today's focus on hair removal and waxing, many women have become much more cognizant of their looks down there. If you feel like you need to tuck or adjust your labia in certain clothing or in certain situations, or if you simply don't like their appearance, you may be a candidate for labiaplasty. When women ask their gynecologists about troublesome labia, they're often told that their anatomy is perfectly normal. And we'd like to assure you that most times the anatomy is perfectly normal, but if it's making you uncomfortable, there often is something that we can do about it. At Banff Plastic Surgery, we can tailor the labiaplasty procedure to each patient's particular needs. In some cases, it's possible to simply trim the extra labia and reshape the labia that way, sewing the edge so that the excess is removed and that the inner labia tucks inside the outer labia. More commonly, however, we adapt the procedure popularized by American surgeon Gary Alter that's called the wedge technique. This allows us to remove the excess tissue where it's most prominent and most bothersome, and then bring the normal edges of tissue back together again. It also avoids making a stitch line along the edge of the labia, and that way we can preserve normal anatomy and normal color or pigmentation of the tissue in that area. And most times, once that incision heals, it's barely perceptible and it's almost invisible even to your gynecologist. Labiaplasty is a real surgical procedure, and it can be done in the privacy and comfort of our office operating room. It generally takes about an hour and a half to do, and many women do just fine with numbing medicine, although we can also offer sedation in addition to the numbing medicine. Patients can go home from labiaplasty the same day, and generally we'll recommend that they have a few days off work because there is swelling afterwards and some discomfort. Sometimes women ask about clitoral hood reduction or reshaping of the labia majora or outer lips. Sometimes those procedures can be addressed at the same time as labiaplasty, but in our practice we don't offer tightening of the vagina itself or other muscular procedures because we feel that's outside our scope of practice as plastic surgeons. So what's the right time to have labiaplasty? Well, as I mentioned before, I've taken care of women all the way from age 16 up into their 70s, because this can be a problem at any of those ages. If you're planning to have children in the near future, it might be wise to wait until after your children are born, just because changes can happen with pregnancy and delivery. You'll want to find a time when you can take a few days off work if possible. The surgery itself takes about an hour to an hour and a half, and you can go home on the same day as surgery, but you will need to rest and recover at home for a few days, and you may even need to take a little bit of pain medicine for a couple of days. You can be driving again almost immediately. Strenuous activity probably needs to wait for 2 or 3 weeks, and sexual activity can resume in about 4 weeks once everything is healed. We'll need to see you back for a follow-up visit at about a month. Please give us a call if you have any questions about labiaplasty.